We got this, and I got you.
Hello everyone, and welcome back to Care Conversations with Griswold Home Care for Chevy Chase. I'm Erin Pickrell, Director, and each month we sit down with trusted community members who are helping older adults and family caregivers navigate the aging journey with confidence. Griswold is celebrating 44 years of providing compassionate care to older adults. Whether it's short-term recovery care, support for veterans, or long-term in-home assistance, our mission is always the same: to help older adults age safely, comfortably, and independently in the place they call home. Today, I'm joined by David Engel from the Montgomery County Commission on Aging. The Commission serves as an advisory body to the county leadership and works to promote the well-being, independence, and quality of life for older adults throughout Montgomery County. Thanks so much for being with us here today. My first question is, can you tell me a little bit about yourself and your role with the Montgomery County Commission on Aging?
Sure, Erin. Thanks for having me here. And it's a pleasure to talk about the Commission on Aging, but just so people know, I was born in Kensington, so I'm not far from where your office is. So I grew up my early years here. Product of Montgomery County schools. My wife, my kids, and my parents all still live in Montgomery County. So I have 91 and 92-year-old parents here as well.
Yeah.
So my current profession is a residential real estate agent, which kind of got me involved with older adults and dealing with challenging family situations, and the change from a 4,000 square foot home to a 600 square foot, assisted living or independent living situation. So that whole transition work working as a real estate agent brought me to the grassroots organization for the well-being of seniors, which you're a part of. And as part of the advocacy committee, I was introduced to the Commission on Aging to be a liaison back to GROWS for what's happening at the Commission on Aging. So I started going to Commission on Aging meetings and was getting involved before I became a commissioner. And I applied twice to be a commissioner, and on my third time, the county executive appointed me as a commissioner. I'm in my end of my second term, as we serve 3-year terms, so I've been officially a commissioner for 6 years, and I've served as the secretary of the Commission on Aging, the treasurer. I've been chair of the commission for 2 years, and I'm currently the chair of the communications committee. So I'm happy to tell you all about the Commission on Aging if you would like.
Yeah, I think, to transition, so how does the Commission on Aging support older adults in our community, or what do they do? I think you had a great answer to that.
Yeah, so the origin of the Commission on Aging goes back to the Older Americans Act, which was in the 60s, but in 1974, the Montgomery County Commission on Aging was created as an advisory body to the Area Agency on Aging. So the Area Agency on Agings throughout the country were formed through the Older Americans Act. And in Montgomery County, we have over 80 boards, committees, and commissions that help advise the county on various different issues, and they all have their own constituencies. So the Commission on Aging is a volunteer group. We currently have about 30 commissioners, all volunteers. Almost all of them are over 60. But there's a couple that are under 60. And we advise the county on gaps in services and programs. We educate the county and residents on older adult programs and services. We try and get the word out. We are the only sort of eyes and ears for the older adult community in Montgomery County, which is the fastest growing demographic in the county, as you know. And so soon there'll be more older adults than kids in school. So the Commission on Aging has 4 committees. We have a communications committee, which I'm the chair of. We have a public policy committee, a health and wellness committee, and an aging and community committee. And they all are open meetings, so they're open to the public, as well as a monthly full commission meeting. And sometimes we'll study an issue. So for example, when I first started with the commission in the Health and Wellness Committee, we were studying hearing loss. And then we saw how hearing loss impacts social isolation. And we ended up doing a public forum back then on social isolation and loneliness, which was during the pandemic, which was really appropriate. But then we also published a fact sheet on age-related hearing loss. And so we have published probably 6 to 10 different fact sheets on areas of health and wellness, and also we have one that's called Life Transitions as We Age. So it's a really nice booklet for the community to start the conversation with those who are important to you as you get older. So those are available online and in public libraries. Each committee works on different topics. So the Communications Committee also publishes or produces a monthly TV show called 50 Plus in Montgomery. We have over 200 episodes that are online on YouTube, but it is a monthly cable news show that's at 30 minutes, similar to this, and we interview somebody and learn about topics. The Communications Committee also has a library liaison program. So I mentioned the fact sheets are in the libraries. We have representatives from the commission go into the public libraries, make sure there's fact sheets and information set up in an older adult section in all the libraries. And then we also have an ambassador program where we go out into the community and talk about programs and services that the county offers. So what we heard as a commission is that people love living in this county. They love the parks and rec and the community centers. They don't like paying for it, but they don't know all the programs and services that are offered. So we've probably been to 12 to 15 different venues to do an ambassador program, anywhere from libraries, community centers, senior living communities, and talk about those programs and services.
And I've absolutely been to several of those presentations, and I guess that was one of kind of my questions, was that those are services from the county, like not necessarily from the commission, right? But that then the commission takes the initiative to, be the outreach and community liaison part of it. From the communication standpoint, we know that people need to know what is available to them, but we also look for those gaps in programs and services. So our advocacy work is at the county level, the state level, and as I mentioned, federal level if they'll listen to us. But we testify in front of the county council twice a year formally, once in front of the Health and Human Services Committee, and then once in front of the full county council when it's budget time. So we take a look at the county budget and we look at the programming. So for example, this year and every year, as you know, respite is a big part of the caregiving process. Caregivers get worn out, they need some time on their own. They may need various amounts of time throughout the year, and we have a great respite program run by the ARC of Montgomery. Well, that program runs out of money every year. There's a waiting list. And this year we advocated to add money to that program, and we were able through our efforts to get, it was a $1 million supplemental appropriation recently for 2 other programs, but I think there was $250,000 extra that went into the respite care program. So those are the kinds of things that we advocate for. Another program that is brand new for both your caregivers that you employ as well as family caregivers is through the National Caregiver Program in Montgomery County. It's called TrueAlta, and it's a web portal that people can use to help them with caregiving support groups, to learn and get educated, get involved with community around caregiving, and that is a program that the county subscribed to recently to help family caregivers. So that's a kind of advocacy the commission does, as well as in Annapolis. So we're heavily involved in what's happening in Annapolis, where the bills are being created every year
There's 2,000 bills that are submitted each year, and many of them impact the older adult population. So we're involved in changing the game for older adults, as well as supporting them through programs and services.
Yeah. Wow. I mean, that is a lot. And I guess, what trends do you see, shaping the future of aging services here?
Yeah, so there's a lot of trends. I think I touched on one, which is the growing demographic of older adults. So we will soon have more older people living in the county than we have younger people. There'll be more older people over 60 than there are in the public school system. And that is healthy aging is a really important thing, and having support systems to help people. The Maryland Department of Aging Secretary says matching the health span with the lifespan. So we need to continue to match that health span by putting more money into the programs and services that are offered. So that trend, the growing large demographic of old people, that's one thing that's happening. I think another thing, and you're involved in this in your company, is the technology aspect of helping people age in place. So technology is advancing rapidly. AI is helping us in so many different ways, that from fall devices to learning people's tendencies in the home, those will continue to advance, and remote monitoring of older people to allow them to stay and age in place. So I think technology is one trend that we'll continue to see escalate. On the sort of the negative side, we see fraud, scams, abuse continuing to escalate as well, and AI is sort of the culprit of some of that. So we have to be vigilant in letting people know what the current scams are that are out there. Tell people don't answer their phones. They love to answer their phone, but don't answer your phone. Don't click on the link on your computer, and educate people on what's, how they can protect themselves. And then also, many people are embarrassed. So we have to let them know that the only way that we can stop fraud is to catch the perpetrators. And then there's anonymous tip lines. They shouldn't feel embarrassed. They're entities, and the county is out there to help them, so they have to let people know. So those are some of the trends that I see. I think one other big one that we're going to have to deal with is housing. And the county currently has it's called MPDUs. So the MPDU program started in the 70s. For every new development, they had to put in 15% of moderately priced dwelling units. Well, when it comes to senior housing, it doesn't always equate to what a community can do. So for continuing care communities and other communities that have sort of wraparound services, they have a service component of the housing cost. And the county and those builders and developers haven't been able to figure out how to build moderately priced units for those kinds of developments. So this year you will see some zoning changes, some permitting laws, some county laws that will come out to strengthen the county's ability to require moderately priced units being built in senior living communities. So even though we've had a proliferation of very expensive communities come into especially Lower County, they haven't been able to figure out how to help those that are of moderate or lower income. So I think that trend of being able to look at affordable housing a little differently for older adults will continue to improve options for those older adults.
Yeah, absolutely. I mean, that is, truly, I didn't know that the commission, was involved so much in advocacy and those, changes on the county level. And definitely we talk a lot about the, middle housing options are lacking. There are a lot of, newer, beautiful homes, and then there is low income options, but then someone who, wants to live in an apartment independently with a fixed income for however long is kind of missing as in our current system.
Yeah, and we've spent a lot of time at the commission looking at housing. Last year we had a public forum, which we have a public forum each year, and last year was on reimagining housing to be more affordable, accessible, and available for older adults in that gap population, those that are too rich for Medicaid but too poor for the expensive assisted living communities. That gap population is really, missing out.
Right.
And we kind of feel, and I don't know how you feel about this, but AARP says 70% of people or more want to age in place.
Right.
And so our hypothesis is, well, do they want to age in place or do they feel stuck in place? Because if they had those options, they could age in place somewhere else. And one of the problems with our aging housing stock is it's not safe and secure for those older adults, and it's way bigger. When they have families and their families were grown and they move out of the area, and the data shows that there's a large percentage of older adults who've lived in their home for a long time, and they're only using, a small portion of that home. So they just don't have the options. However, on the flip side, there are county programs for home modifications. So we have the Design for Life program, which is a tax credit program through the permitting office. And then we have the HARP program, Home Accessibility Rehabilitation Program. And that is run through Habitat for Humanity and Rebuilding Together. So we do have some options for helping people age in place. And the Commission on Aging has worked on both of those programs to advocate for, on one part, putting more money into the HARP program because it has a waiting list. And on the other hand, the Design for Life has a funding mechanism, but it's not being used that much. So we need to get the word out for that program and have more people use that for incentivizing them to put in grab bars, ramps, elevators, lifts, anything, modify the bathrooms, whatever they can do to help them be safe and secure in their homes.
Oh, wow. Yeah, I mean, definitely, because, I agree that, everyone or most people want to age in place, but maybe you're right. If they had a different option where they felt safer and felt like they could afford it for the rest of their lives, maybe that would be a good option. And I think, having options is just, one of the best things about, I guess, living in Montgomery County and, getting older is that you can, make those choices, and you want to be able to make those choices confidently. And I guess, so what are the biggest opportunities or challenges facing older adults and their families?
Well, I think we've talked about a few of those. Opportunities, I think people need to reach out. They need to look for those resources that are available, like the TruAlta portal that I talked about. I'm sure 99.9% of the people don't know about those, and the caregivers don't know about those. So I think there's a lot of opportunities if people are aware of what's out there.
Yes.
I think another challenge in our county is the diversity, and you have a large part of our population, especially the older population, that doesn't speak English as their first language. So a lot of the barrier to getting those services, whether it's transportation, housing, food, nutrition services, using the senior centers, is the communication level. So we need to do a better job as a county providing both printed and online services for those that don't speak English as a first language, but also culturally sensitive. So I think there's over 100 languages that are spoken in Montgomery County, so it's a huge task.
Yes.
And we also know that with older adults from different cultural backgrounds, aging and the stigma of asking for help is looked at differently in all different cultures. So educating our caregivers, educating our aging services providers, educating the county council members on what the needs are of all these populations is really important, because it's not just one size fits all.
Yeah, that is a good point. It is very diverse, and finding the best places to reach people so that they do know the services that Montgomery County has is really important. I guess too, I feel like you've answered this question, but let's say what's one local resource that you think every older adult and family caregiver should know about?
Well, if I'm stuck with one, but I'm not going to stick with one.
You can do.
But I'm going to say, when we do our ambassador program, we tell people that if there's one thing that they leave today with, it's the Aging and Disability Resource Unit hotline. So it's 240-777-3000. And that's for Aging and Disability Services. They take over 25,000 calls a year, and they sometimes can help people on the phone or direct them to the right program or service. So that one single phone number is super important. I think we're in the building where the Beacon is, right? So the Beacon newspaper, huge resource. They put out their yearly resource guide. They have an aging fair, once a year in the fall, and they have their monthly newsletter. So that's a great resource for people. And now they're merged with Positive Aging Sourcebook, which is a wealth of information for housing, aging in place, home care, many different aging services. I would say also the newsletters that are available from the county. So you can go to the county, it's gov.delivery, to sign up for newsletters from anywhere from the county executive, county council. There is a monthly senior newsletter that comes out. And also the National Family Caregiver Program has a tremendous newsletter now that comes out once a month, has many programs that are not just family caregivers, but support groups, events that are going on around the county. So that's a really great resource as well. And GROWS, right? We both belong to GROWS, the grassroots organization for the well-being of seniors. That website has a directory of service providers that help older adults. So I probably could keep going on. Oh, and then also big news in our county is JCA, the Jewish Council for the Aging, and JESA are merging. So both of them provide major services for older adults, and by having them merge, I'm hopeful that they're able to expand and sustain their programs for a longer period of time, because funding is always tough. But JCA has a hotline as well, a senior hotline, and then they also help a lot with transportation services. So I could go on and on about that, but those are some major ones.
I subscribe to, several newsletters, and the Montgomery County monthly, caregiver newsletter, I really think is very helpful. And of course, I think the amount of information can be overwhelming, but maybe you just have 15 minutes, you read the newsletter, and it does have some unique opportunities, webinars, of course, support groups, things like that too. And I have another kind of difficult question, is that what's one piece of advice that you'd like every older adult watching, to remember? I think the number.
So, well, that's one, but I would say that advice I think is most important is don't wait for a crisis, right? Because you get calls in your business that people need somebody yesterday because someone fell, or they're coming back from the hospital, or something happened. So the biggest piece of advice is don't wait for that crisis. Plan in advance. Try and maintain a safe and healthy home that you can live in, and have people that are your go-to people for whether it's transportation or medical or whatever they are, that can help you in different circumstances. So it's don't wait for a crisis.
That's great advice. Well, thanks so much for sharing your insights and the work you do to advocate for older adults in Montgomery County. Anything else you thought you were going to say that you didn't?
What I thought I was going to say, well, I could talk more about the Commission on Aging and the work that we do.
Yeah.
So I will just say that all commission meetings, if I didn't say it before, are open to the public, and all our committee meetings are on the web. I would go to montgomerycountymd.gov/senior, that's the senior site, which has different departments, but there's also a big presence there. It's easier to find that way. You click on the Commission on Aging, you can click on 50 Plus in Montgomery and watch those shows. But once you get to the Commission on Aging, you can see the dates of meetings, and you can also see the fact sheets that I mentioned. You can download the fact sheets and resources that we have from the website directly. So I think that's really helpful.
Yeah. And so, as we talked about, aging well is about more than, healthcare. It's about staying connected, informed, and having access to the right resources and support systems. As always, if you or a loved one could benefit from in-home care, Griswold Home Care is here to help. And thanks so much for watching, and we'll see you next time on Care Conversations.